Welcome to a demonstration of RxNT's billing solution for medical practices. My name is Jessica, and I will be taking you through today's demonstration. What you're looking at now is the RxNT dashboard for a medical billing solution. On this dashboard, we provide critical information from provider charges, and by hovering over this graph, you can quickly determine how much has been charged for Dr. Jones. You can also see the payments for Dr. Jones. Other critical information on the dashboard includes the aging snapshot, which is not only broken down by age, but it's also broken down by payer. So again, at quick glance, you can determine exactly what's outstanding for your insurance company. Other information on the dashboard includes alerts. Alerts could be unbilled encounters or dates of service that have actually flown over from the electronic health record and have been put right into the billing solution, rejected claims, claims ready to be sent electronically, insurance payments, even patient payments. And what this does is this allows you to determine exactly where you want to spend your time today and how you want to work the claims that need to be sent out. I will go ahead and I'm going to jump into the Unbilled Encounters tab. By clicking this is going to start my billing workflow. As I mentioned, unbilled encounters could flow over from the RxNT electronic health record, or you can create a new encounter from scratch. Before I create a new encounter, though, I do want to familiarize you with the RxNT system. Each module that you're working out of in the RxNT system has built-in reporting. This will allow you to filter the data based on the fields that you see on the left and limit the data based on the criteria that you see on the right. So you can really control exactly what you see, and every report in the RxNT system is exportable from the program, either as a PDF or you can export it as a CSV file or Excel file and manipulate the data for your reporting needs. But what I'm going to do is click in the top right-hand corner and select New Encounter. This will launch me into a new date of service, and this is really where the billing process begins. If I was going to be billing for a UB04 client, or if I am primarily a UB04 biller, I'll simply select Switch to UB04. Otherwise, for our CMS 1500 clients, what you'll do here is you'll click on the search button and select the patient that you wish to bill from. Now, we can receive demographic information several ways. It might be coming over from the RxNT scheduler, the RxNT electronic health record, or maybe you have an interface, or maybe you're simply manually adding demographics into the RxNT system. Whatever that looks like for you, when you select a patient, several defaults will populate. We'll populate the payment or the responsible payment party. We'll populate the place of service, the rendering provider, the billing provider, even the fee schedule and the case information. Other information being defaulted will be the diagnosis. And we actually pull this in from the previous date of service for this patient. So from here, all you'll need to do is click the green plus button and add a new line item. Maybe you want to bill for a 99213. By searching for the line item that you want to bill for, we will automatically populate the charge that you've selected. From here, you can elect to check the box on the far left-hand side and pull in a diagnosis from a previous date of service, or maybe it's a brand new diagnosis. If you know the ICD-10 code that you want to bill, great, just plug it in here. But if you only know an old ICD-9 code, or maybe you only know a keyword, you can use the information that you have and run a search in our system. For example, broken arm. By typing that keyword, We will actually provide you a plus sign indicator alerting you of the highest level of specificity required and that you've actually found that. Where there's a red eye indicator, we will alert you that a secondary or additional diagnosis code needs to be plugged in order for you to bill the code that you've selected. And then we provide you an arrow anywhere you need to drill down and find a higher level of specificity. And it's just like what it sounds. We'll actually provide you drill down technology where you'll select the initial encounter, you'll select the fracture type, and then of course you'll select the laterality. All the way you've got a plus sign alerting you of the fact that you found the highest level of specificity required. And from here, I'll simply select the plus sign. Now notice, it did not plug that diagnosis into the line item because it is a duplicate diagnosis. This is just one of the examples of the claim scrubbing that RxNT provides. Once you've added the line item and attached the diagnoses, you've got two options. You could save this, and this will remain an unbilled encounter, meaning that you'll continue to get alerts on your dashboard. You would want to use this if you're missing critical information for that claim. Maybe you're missing a date of service, or you're not sure if Dr. Hall really is the provider who saw this patient. You can click save, and that will again remain as the unbilled encounter. Or you can convert this to a claim. Some of our clients prefer to select save claim, and this will save this claim to a batch so that you can send it at a later time. Other clients prefer to select send claim, and this will again send the claim in real time, and you will get a response from the clearinghouse within 3 hours alerting you of the status of that claim. That brings us to the top navigation bar. Because I accessed the encounter screen from the dashboard, I didn't have to click on encounters in the top navigation bar, but you can certainly access the encounter screen from here as well. After completing your workflow in the encounter screen, we'll move from left to right along the top of the navigation bar and select claims. This claims tab is where you'll be able to see the status for all of your claims being sent from the RxNT system. What we do for you is anywhere you've actually selected Save Claim, that will populate here in the To Send Electronic tab, so that you could select one, maybe you want to select two, or maybe you want to select all of these and send these to the clearinghouse. Where you're working with a paper-only payer, we actually have an electronic submitter ID, allowing you to send those paper-only claims electronically to the clearinghouse, and the clearinghouse will print and distribute those on your behalf. Where you need to print these claims, you can certainly drop these to paper and print them in a bulk, or what you can do is click on the claim that you want to print. And just to give you an idea of what that looks like, we actually pull all of the information out of the encounter to populate the CMS 1500 form for you. Other potential statuses for your claims include pending, meaning that they have gone to the clearinghouse, resolved, canceled, errored, or maybe even rejected. Regardless of the status, we will actually provide you a reason for that status. For example, the rejection tab will give you reasons as to why that claim rejected, and it'll also tell you exactly what needs to be done to get this claim back out the door. If you need to update the patient information or provider information, maybe even practice information, whatever that looks like, you can make the modification in the RxNT system and send one claim back to the clearinghouse, or if you've modified them all, you can send them all back to the clearinghouse. We also will keep track of your no response claims, and again, this is also an alert on the dashboard for you. But once your claim processes through the cycle, the next step is the insurance payment screen. Now, it does not matter how you select to receive your payments. Some of our clients like to receive an electronic funds transfer and have the money deposit directly into their account, while other clients really prefer paper checks. That's not going to impact or affect RxNT's ability to receive what's called electronic remittance advice. Electronic remittance advice allows RxNT to auto-allocate 100% of that payment. So you'll not only know that you've received a payment from CareFirst and that it was received on November 29th, or that it came in as an electronic funds transfer, but we'll also tell you the amount for that payment. We'll also tell you the patients covered on that payment. And if you select on a specific patient, we'll even allow you to drill in and see the dates of service covered on that payment. By selecting on a date of service, you can jump right into the line item and see everything from the charge amount to the allowed amount, all 100% auto-allocated on your behalf. And this will help you so that all you have to do is review the information, select leave open if you don't agree with what's been selected, but if everything looks good and it's exactly what you expected, you're ready to click Save and Post. Now, for those billers who really like the paper EOBs or the paper version of the electronic remittance advice, you'll have access to that as well. And when we receive that electronic remittance advice, directly to the left of this attached document button lives a print ERA button. And I'm not able to show you that in the demo environment, but when you get that in, all you'll need to do is select print ERA, and that will pop up a PDF version of the ERA. You can scroll through the PDF, or you can simply click print and print that off so that you have a paper version available to you. Regardless of which method you review the payment, when you click Save and Post, one of two things will happen. For Mary Beth Jones, we can quickly identify that she has a secondary because RxNT has automatically checked the box under the Enable ReQueue claim. So anywhere your patient has a secondary insurance company, this box will automatically be checked. So when you click Save and Post, we will queue up a claim to that secondary for this particular patient. For Kristen Miller and Tom Johnson, I can hover over their box and I get a circle with a cross through alerting me of the fact that this patient does not have a secondary insurance company. So when I click Save and Post, that is moving the responsibility to the patient, and we will automatically update that patient's balance, which will enable RxNT to create a statement for that patient automatically. So I will go ahead and skip to the statement section in the top navigation bar, and by clicking here, this is where I'll get to review all of my patient statements. You can set up the statement cycle to run however you want it to. Maybe you want the statements to run monthly. Maybe you want them to run every other week. Whatever the criteria is that you've established, maybe even excluding some statements from being run so that you're only seeing statements for patients that owe more than $20. Whatever that is, we will populate the statement for you, and I'll go ahead and select on a statement so that you can review exactly what that looks like. If at first glance you're looking at this and you say, this is great, but I don't accept Visa, that's a statement setting as well. So it's very customizable and easy for you to control. It'll include the line item and the patient balance. And as I scroll to the bottom, it'll have a custom message. This is customizable based on the number of attempts or the number of attempts this statement is. So they could look drastically different for your first attempt than they do from the fifth attempt. Now you can, of course, print these yourself and distribute those to your patients. There is no charge for that. If you do wish to use the clearinghouse service to have these statements printed on your behalf, the clearinghouse will actually print these out. They will put them in an envelope within a return envelope, first class postage, address them, and then mail them on your behalf. From here, the patient might walk into the doctor's office and maybe you're seeing the patient the next day. The scheduler demonstration, which is in a separate video that you can watch, or of course you can talk to a member of the RxNT team to see that fully integrated, will actually update the scheduler so that you know exactly what that patient owes right when they walk in. Or maybe the patient makes a payment and they mail that back in. You can manually add a new patient payment as well. So there's several options for how you can get patient payments into the RxNT system, which rounds out the workflow of the RxNT system. So I do want to take a moment and focus on a couple of really critical reports. One report is the aging report. And the aging report functions just like the module-specific reporting that I showed you. You can select your criteria on the left-hand side and filter the data. For the purpose of the demonstration, I'll keep everything open and select search. You will see a very similar aging snapshot as to the one that you saw on the dashboard. Looking down to the summary section, you'll also have a summary available to you. And as I scroll down, that's where you really get to drill into the details of the report. You can sort the data by service date, patient name, you name it, whatever you need to do with this report. It's very flexible. Going to the far right-hand side, you can even determine exactly what data you want to see. So maybe you only want age interval and you don't want to see service date. All you do is deselect that and the report will look different. All of the reporting is available for export, again, CSV, Excel, or PDF. So it's very easy to dump this into a spreadsheet and to play with the data if you need to, or you can provide a PDF as well. So it's whatever you need, it's a great report for you to access. From here, I'm going to go back into the Reports tab and show you a very comprehensive report, maybe for the transaction journal. All I need to do is determine my criteria, so what date range that I want to see. And I'll select Run Report. This will give me a high-level view of everything that's happened, whether it's an encounter, and we do, of course, provide the summary, whether it's an insurance payment or a patient payment, claims, statements, whatever that might look like. You'll be able to access this data. And again, all of these mini reports are exportable as well. So if you want them in an Excel sheet, great, you can export those. And then one thing that we hadn't yet talked about are patient funds. In the event of an overpayment, RxNT automatically creates a patient fund that can be applied to a later date of service, or of course you can refund that to the patient. From here, I'll select reports one more time, and then I'll go into the revenue report. Again, you select the criteria that you want to filter this report by, and you can select a revenue report or a charge revenue report. You'll give this report a name, and you save this to the queue. By saving this to the queue, it allows you to access historical reports at any time. So let me begin by showing you the revenue report. Maybe I want to see the revenue report from last December. I simply select on the report and we start out by showing you a summation, everything that's happened at a very high level. But we also allow you to drill into the billing provider, the rendering provider, the insurance company, maybe even the case information, all the way to the patient level. So you can have as high level of a report as you need or as a detailed report if you need. And again, exportable by CSV or PDF. One other report in the queue that I want to point out is the charge revenue report. This charge revenue report allows you to see the data for each procedure code. So for example, maybe I want to see exactly how many times I billed a 99213 for Peter Jones. I can quickly glance and see that I charged or I billed that 3 times. I charged a total of $780 and I have been paid $360. Again, this is reportable by or exportable by CSV or PDF. Thank you for your time today. I certainly appreciated the opportunity to go through this demonstration with you. That pretty much concludes the overview of the billing solution, but there's so much more that you could learn or ask about. So if you do have questions and you'd like to learn more, please contact RxNT sales team at 1-800-943-7968, option 3. Again, that's 1-800-943-7968, option 3, or email sales@rxnt.com. Thank you again for your time today.